Today I'm showing you a case of brain herniation into dural venous sinus. It's a under-recognized entity that from previous low-resolution MRI, the more recent updated MRI, they show this entity more. May or may not be symptomatic. Here what I'm showing you here. On the left side is April 3rd, 2017, a 30-year-old lady. On the right side is July 2nd, 2018. So both times we see this 5 millimeter lesion in the right side dural venous sinus right here. You can see from the previous study it is more directly contiguous with the middle temporal gyrus on the right side that herniating into the transverse sinus, dragging along the portion of the CSF, which is the white area surrounding this gray blob, which is a part of the cortex. Doesn't have any abnormal signal of the adjacent white matter or this herniated brain, but may cause some blockage of a CSF drainage dural venous sinus drainage blockage, or maybe pinching on the brain parenchyma. It's hard to tell. It didn't change for a year, more than a year. And here is the lesion. So right here, didn't change for a while. So the flare signal showed this. So you can see the literature report, just exact location, same portion of the temporal lobe. This is 11-year-old patient. This is some cerebellum herniation in a different patient. This is probably a CT finding of another patient. This is another place that, again, in the same area, temporal lobe. So sometimes they have symptom. If they don't have symptom, why do they have the MRI? It's hard to tell whether they are directly related to this finding. May be related because there's nothing else to be found on those patients' MRI. So take a look.